This is Dr. Paul Thomlinson from Compass Health Network, and I'm doing a continuing series aimed at inspiring hope and promoting wellness in these times we're living in and living through. This is part 2 of a 2-part series in which I chronicle my own fight against COVID-19, which recently had me down for the count for about a month. Here in part 2, I want to talk about a surprise medical twist to my story and also assess how well I did at taking my own advice and applying my own recommendations, many of which I've shared in this podcast series. I've alluded to a surprise medical twist in all this, so let me describe what I mean by that. My fight against COVID lasted much longer than the CDC's average of 10 to 14 days. It seemed to go on, and even worsen after the first couple of weeks. Now, I'm a statistician and a researcher by training, so I'm fully aware of what an average means. Of course, that means some have shorter episodes. My partner Josie's symptoms lasted 4 or 5 days in earnest, and some are longer, like mine. I thought, as did my doctor, that I was just one of the long haulers, as they're sometimes called. I'm quite a bit older and much more male than my partner Josie, and both of those things are predictors of worse and longer COVID symptoms. But come on! This was getting ridiculous. Symptoms getting worse? Fevers getting hotter after 2 weeks of suffering? Now, I've always been pretty resilient and tough, I think, in the face of colds and bad flus. It's always taken a lot to get me down, to force me to take a sick day. It's pretty rare. So I started thinking something else might be going on, perhaps some kind of autoimmune disease kicking in or something. It just didn't make sense. But ultimately, I chalked it up to a bad case of getting older and being more susceptible to the impact of this nasty virus. But especially after those first 2 weeks, those closest to me, my partner, my sister, my dear friends, began to collude to get me to go to the hospital. I kept saying, I'm not going to the hospital unless I start having trouble breathing, which I understood to be the basic criterion for admission. But they persisted in asking me to go, and I stubbornly refused for a couple weeks. My mantra was, they're not going to have anything for me unless I'm having trouble breathing, and thankfully I wasn't. My doctor was saying the same thing. The hospital doesn't really have anything for you. But enough was finally enough. Nearly 4 weeks in, I finally relented and agreed to go to the ER because, frankly, I couldn't take it anymore. I just needed some kind of relief, anything. And I was worried that I was not going to get better on my own. I won't bore you further with all of the details, but I'm glad I finally went to the hospital. They confirmed that I was still COVID positive, and they did chest x-rays to make sure I didn't have pneumonia, and did blood work, urinalysis, ran CAT scans. They also hooked me up to a bag of IV fluids and gave me some Toradol, a very lovely non-steroidal anti-inflammatory. After that, I began to feel human again for the first time in a month. A sense of calm came over me. I felt like my body and mind were finally reunited somehow. It was glorious for a little bit. When my labs showed that my liver enzymes were off the charts, the ER doc was puzzled because COVID doesn't usually have that kind of impact, she explained to me. As she was leaving my ER room, though, she must have had a flash of insight because she turned around at the door and asked, "You didn't happen to have a tick bite recently, did you?" I felt like I was on an episode of House. Boom, flashbulb, clear memory. About a week before COVID struck me, back in August, I did indeed remove a tick after a hike in the woods with Josie. Didn't think another thing about it until the doctor asked me in the ER. So they ran a tick panel to check for tick-borne illnesses. Now I was released from the ER and sent home after 5 or 6 hours, feeling human, non-febrile, and calm. I think those IV fluids were the magic thing that night. So I went home, slept for about 4 hours, and awakened with my highest recorded fever of the whole run, 103.2. I was devastated to be right back where I started, with full-on symptoms returning. But, thankfully, that was the last of the high fevers. I seemed to have turned the corner in a big way, as over the next few days I began to awaken in the morning with only low-grade fevers and then finally none at all. It took a full week and a half for them to call me back with the tick panel results, but when they did, they confirmed that I was positive for ehrlichiosis, which is a very nasty tick-borne illness with symptoms that are pretty much identical to COVID-19. Google it. I did. So finally, it made sense why I was so sick for so long. I had both bacterial and viral infections contributing simultaneously to my illness. So I was started on doxycycline, which is the standard treatment for ehrlichiosis, but only after my symptoms had all but abated, pretty much, days before. I sure wish I'd had that early on. But who knew? How could I? How could they? How could we have known that I had them both at the same time? I don't do anything halfway. So the lessons I learned from this are as follows. 1, when the people that love you are begging you to go to the hospital, even if you can't envision what they might do for you, go already. Just go. I wish I had done that a week or 2 earlier. Number 2, be careful of those nasty ticks. Ehrlichiosis, along with other tick-borne illnesses, are pretty common in this part of the country. So if you have COVID-like symptoms but don't test positive for COVID, maybe check yourself for tick bites and get tested if you have one. And number 3, don't get any other illness if you have COVID. It's no way to spend your summer. So now that I've told the story of my illness or illnesses, I want to finish with a look back at how I did with respect to applying all this stuff I'm always talking about, to see if I really do put my money where my mouth is as a psychologist when I'm also the patient, to see if I take my own advice and sort of give myself a report card. Those of you who have been listening to these episodes of this podcast that I started back in March at the beginning of the pandemic, you'll know that I've done some very targeted episodes on how to deal with the pandemic generally. But it strikes me that they're even more relevant to how to get through the actual illness itself when it finally comes home to roost, as it did with me. In particular, I thought I'd talk about how well I applied meditation, learned optimism, and my relentless call to learn how to lean on and develop social networks and relationships during difficult times. Okay, so I'm going to give myself a passing score on my use of meditation during my illness, and in particular using it to hopefully ramp up my immune system, as well as improve my peaceful state of mind in the midst of the illness. After my very first night of really high fever and fevered dreams and almost no sleep, I got up early in the morning and positioned myself comfortably and went through my own version of the meditation on uncertainty that I shared with you back in March. I also applied what's called the loving kindness meditation to myself, to my own body in particular. And that included apologizing for not taking better care of it and more thoroughly equipping it to do what it was designed to do. Now in my recovery, I can tell you this is bearing fruit, as I'm so grateful for every opportunity to use my body in healthy ways and continue to build it in a way that will make it better able to fight off any future viral or tick attacks. I'm also going to give myself a passing grade on using my natural and learned optimism skills. As you may recall, that's all about learning how to think in a more healthy way and resilient way about setbacks. And Lord knows contracting COVID qualifies as a setback. In particular, you may remember that the optimistic person focuses on the 3 Ps: personalization, persistence, and pervasiveness. I have been focusing relentlessly on the fact that this setback is not my fault. It's not personal. It's not going to be persistent because I'm going to fully recover. And so I also told myself at the height of my symptoms, mostly. And it will not be pervasive, meaning it will not affect all other areas of my life. Not if I don't allow it to. Well, it kind of does during the quarantine phase, of course, but you get what I mean. And actually, now that I think about it, I learned a few challenging guitar pieces while flat on my back in bed, so I didn't allow it to take over everything that matters to me. If I was to give myself a less than stellar grade on my recommendations, it might be on the extent to which I've really leaned on and leaned into the wonderful social and relationship network that I am blessed to have. Why is that? I think mostly because neither my partner nor I are really keen on attention-seeking for things like this. We don't want people's pity. We don't want to worry the people that we love. So we've done a pretty terrible job of really keeping people up to date on our status and our progress. And with a few notable exceptions of folks closest to us, we've really not allowed anyone to do much of anything for us, despite many offers of such kind assistance. On the other hand, I have to tell you how great it feels. What a shot of medicine it is in the middle of a dark night when I awaken with a fever in such misery. To know that there's a quiche in the fridge, or a shrimp cocktail, or chunks of chilled watermelon, my favorite, or a care package of goodies sitting out there as tangible reminders that people love us and care for us and will be waiting for us on the other side. So even though I didn't make full use of it, It really was those loving connections that pulled me through, I'm convinced. And yes, I know I'm beyond blessed to have that. And I grieve the thought of anyone having to experience such illness without it. It's made me much more sensitive and empathic toward anyone suffering illness that isolates. And it's made me want to do a much better job of reaching out, reaching in, and touching people in the midst of that kind of suffering. Because it matters. Because it is real medicine. Because I know what it feels like to have it offered to me when I needed it most, and how very much worse off I would have been and would still be without it.